Welcome in. So if you guys have questions, drop them in the chat. I'll go ahead and answer them. Appreciate all the likes and double taps, support for the stream. And also, if you guys have x-rays, you can drop them in my Discord channel. Thanks for joining in. Welcome to the live stream. If you're joining me either on YouTube or TikTok, I can see both of the profiles. I'll take questions from both, and we'll go from there. Hey, Susan. Oh, last name Donnelly. We have a spine surgeon on here. One of my buddies, his last name's Donnelly. Welcome to the live stream. Carl the Skunk, thanks for joining in. Welcome. If you guys have x-rays, so we have our Discords going strong. We got the Discord channel on here. You can drop x-rays in the Discord. For those of you who don't know, I'm an orthopedic surgeon. I practice in Washington, D.C. I do a lot of hip and knee and minimally invasive joint replacement. Evangela Diaz, say hi. Hey, how's it going? Kira, can you talk about patella tilt and meniscus tears? Patella tilt, a lot of people do have patella tilt. The patella tends to tilt out laterally. It can cause things like patellofemoral syndrome, patella maltracking, increased pressure on that patella. It's very common in females. Females have a little bit more tilt, and just because you have tilt to your patella doesn't always mean that you need a surgery or anything like that. Do I do shoulder or back? I do treat shoulder and back non-operatively, but I do mostly do hip and knee replacement. So once a shoulder or a back needs an operation, then at that point I would refer over to my partner. What is patellofemoral maltracking? It's how the patella moves in the groove. So if the patella moves wrong in the groove, then it would be what we call maltracking syndrome. Welcome to the live stream. Do you like Mr. Beast? Yeah, Mr. Beast puts out good content. I think he's kind of conquered live streaming, and he's taken really objective data, and so I think he's done a great job in figuring out what works. So I think he's a model for most people who are doing trying to capture audience attention and grow in that manner. Advice on sciatic nerve pain. Obviously, we're in different realms, right? So there's people who are on social media to entertain and provide comedic relief, and then there's educators. So I think I fall more into the educator category, which may not be as popular, as some of the other ones, but at least it's kind of my craft and helping people. So, hey, what's up? Checking in from Texas. Always good to see you. How soon can one get back to work after a total knee replacement? Thank you for the roses, Lori. 2 weeks for remote work, 4 weeks for desk work, and then about 6 to 8 weeks if you're doing heavy lifting. Bone-on-bone knee issues, yes, we call that arthritis. If you have arthritis in your knee, we'll try things like injections, medications, anti-inflammatories therapy. No, I haven't spoken with Dr. Mike, so I don't know him personally, but I have seen him on here. Welcome to the live stream. Thank you for joining in. I had a total knee replacement 9 weeks ago. Hope you're doing well. How many gel shots can a person get? There's no restrictions on number of shots you can get. But usually by a person's 4th or 5th injection, we're usually leaning towards a replacement surgery. So if you guys have x-rays and want me to look at anything, that's my YouTube statistics, but if you want me to look at anything, you can always post your x-ray in my Discord. It's in the bio. You go to the bio, you drop the x-ray in the Discord. I'm starting up been growing a medical Discord channel. We got some docs in there. We got Dr. Sood is in there, a great pain specialist on this channel. We got some other docs from TikTok in the channel, so we're just trying to grow that. How hard is the recovery for total knee replacement? Total knee replacement is it's a big operation. People used to stay in the hospital a while. I do these and they're outpatient, meaning same day operation, so patients are going home the same day. And so there's been a lot of improvements on that front of total knee replacement operations. I have really good guides and information as far as how to recover from that. 9 weeks post-op total knee replacement, doing 120. That's great. Keep working on the flexion. You'll continue to gain flexion. I would say on average people get to about 0 to 120, but even after up to a year, you'll make improvements in range of motion, and that can even increase to 130, 135. Really good patients I've had up to 145. Your website has helped 2 colleagues of mine. Awesome. That's really good to hear. Guides are good, and that's what I try. And then this Discord chat, which I think is going to be huge. We have some docs in there answering questions. I'm in the Discord, and so that's been really enjoyable. After a total knee replacements and the collaterals tear, can they repair on their own? Depends how bad you tear your collateral ligaments. If you tear your collateral ligaments all the way across, sometimes they won't heal. It may take 6 months to a year to recover from that. Thoughts on bilateral simultaneous hip replacement, bone on bone? I usually try and avoid it. I usually try and do one at a time, one hip at a time. If you really need them done, I could do them 4 weeks apart, but it just lowers the complication risk by having one done at a time. And then you get to see how you recover from it. Did I see the LSU game Saturday? I did. I was a little bit disappointed with LSU the first week. Brian Kelly has a massive contract. It's $100 million over 10 years. Jose Mac, thank you for the subscription. I appreciate it. You are the 4th subscriber. So we got 4 subscribers to the channel. Thank you. I think so. What I'm going to do, if you're a subscriber on here, I'll probably give you a badge if you're in the Discord too. So I'll give you a subscriber badge in the Discord. Just let me know. But if anyone has x-rays or MRIs, just drop them in the Discord. I'll answer them live on stream. I'll let you know what I see in your x-ray. You basically go to my profile, click the Discord link, go to General, and click the plus. Okay, so nice little tag you got there, Jose. I got an MRI. It says I have involuting a non-ossifying fibroma. So the word involuting isn't really a common word we use for describing the bony lesions, but basically a non-ossifying fibroma is a benign lesion. Benign meaning that they don't grow rapidly and rapidly destroy bone or things like that. Involuting they may be talking about the kind of pace that it's basically collapsing on itself, meaning if they have a previous scan, if they have a previous x-ray or previous MRI, then they can compare it to it. So the biggest thing with any type of bone tumor or bone lesion like an NOF or non-ossifying fibroma is you want to make sure it's not changing in size. So if there's not a pattern of growth, a lot of edema around it, or it looks like it's causing a stress fracture, then there isn't a lot to do about it. But if that NOF, non-ossifying fibroma, is in a position where it could cause a stress fracture, or it's close to the cortex and it could break through the cortex, then you would do a stabilization either with a plate or a nail. So, involuting they may mean by that it looks like it's collapsing in on itself, meaning it's getting smaller over time. But that's not a common word I see in an MRI scan. But thank you for subscribing. Yeah, let me see if there's not a common word that I see. It may mean that there's like some vascularization to it, but not a common word I see in the MRI scan. So most of the time for NOF, we just watch them. If they change or they look like they're going to cause a fracture, we would do surgery for them, but most of the time not. And it also depends on size. NOFs can be different sizes as well. I'm a workman's comp claim adjuster, so this is interesting. Welcome. Hopefully this is helpful. Try to post orthopedic. So workman's comp, there's a lot of orthopedic workman's comp, meaning people get injured at work. And partially visualized is the marrow edema within the femoral shaft. So it looks like there may be a little bit of inflammation as well. Let me see what they're referring to. So basically involution, meaning they're Involution, when it is referred to radiology, they're meaning decreased in size, so getting smaller. So, I don't. The only way they would be able to use that word involuting, would mean if they had a prior scan. So they maybe have a prior X-ray or a prior MRI they can compare to, and so if they compare to that, then they can say involuting, meaning getting smaller. My bipolar hip implant rotates 90 degrees. Normally we want it fixed into place and not rotating around. Let's see. Mary Ann says, I had my right knee replaced 3 years ago and my left one a year ago. Best decision ever. I'm glad you're doing well. Hopefully you like the channel and like the videos. Edematous prefemoral fat. So that's basically just every bone has a little bit of fat around it. If there's some reaction, then you'll see edema. Edema is like inflammation. Hey, Doc, once again, must mention the top tier hair genetics. Thank you. I've been traveling. I had to drive a lot today. I had a conference in Maryland I had to drive out to, so I drove 3 hours yesterday, 3 hours today. Thank you. Welcome to the live stream. Looks like we got 2 of the subscribers in here. Thank you for subscribing. Very much appreciated. Gout or a bunion? Gout is very painful. A bunion is more of a cosmetic deformity, but can still be very painful. All right. Point 1 says, anyone considering total knee, it'll be worth your time to have a consult with Dr. Harb. He's racing cars. I replaced his knee not too long ago. So my guy from Texas. Yeah, there were also Texas almost beat Alabama too. If you were watching that game, I think that was week 1, but that was a good one. But if you guys have X-rays, you could drop them in the Discord. I'm answering X-ray pictures. So I think, let me see if I can scroll in here. We've got stuff everywhere. All right, so, people have dropped their X-rays. I've gone over their X-rays in there. So if you have any X-rays or images you want me to discuss, it also says I have a cortically based peripheral sclerotic lesion. Yeah, so those are common. We usually call those bone islands. A sclerotic lesion tends to be bone island, tends to be benign, not progressing. So I would just keep an eye on it. You could usually follow these things with the X-ray to see if they progress. Thoughts on a high tibial osteotomy? I'm not doing a lot of them. Usually, unless you're very young, that would be the only time that we would do a high tibial osteotomy to kind of adjust that. Oh, look at that. WKL8410. Thank you for subscribing. We hit 5 subscribers. That's incredible. We achieved the subscription goal. Awesome. Dan, hey, how's it going? I'm delaying total knee replacement a year. Should I let an orthopedic give me a cortisone? Yes. So if you're delaying a cortisone, injection, then or delaying a knee replacement, then cortisone can be helpful. So I have many patients who come to me. It's summertime, or they want to go on a trip. They want to go to France or go hiking or do a bunch of things before they either retire or get a knee replacement. So a cortisone injection can be very helpful for that. Let's do this. Let's see. All right, I'm just editing something real quick. Let's see if we can. There we go. Sorry. Okay, there we go. All right. Hey, my toe hurts nonstop. The joint is so painful. It depends where your toe hurts exactly. If it's your big toe or your little toe, the big toe, it could be gout, or it could be a bunion, or it could be a hammer toe, or it could be a mallet toe, or it could be metatarsalgia. So the toe and the ham are very complex because there's so many bones and so many little joints. So it's hard to say. It would depend exactly where your foot's hurting. How long does a cortisone shot last? Cortisone shot lasts on average probably about 3 months, but I've seen patients where it has lasted longer, and I've seen patients where it's lasted less. They also say bilateral patella tendonitis with the findings in my MRI. I'm only 21. Patella tendonitis is inflammation. So if you're looking at a knee, tendonitis means the tendon's inflamed. If you're looking at a knee, this is the tendon. When the tendon's inflamed, that's when you get tendonitis, meaning that edema, that inflammation around it is on the tendon. So sometimes that's either people are exercising, like doing a bunch of box jumps, or like a bunch of deadlifts or different activities that over-exacerbate those tendons. Treatment for trigger thumb, I'll sometimes do an injection, a cortisone injection for a trigger thumb. So it depends. If it doesn't get better with a trigger, with an injection, then you could do a release. I know I have a pinched toe on my pinky toe. My joint on my big toe is in constant pain. So if it's does your big toe look like this? Meaning, here, let me show you. So we call it hallux valgus or a bunion. So does your big toe look like this? So does your big toe look like this? If it looks like this, and this is where you're having the pain on the big toe, this is a bunion. Now, if the toe looks straight and you don't have this big bump, there's something else called hallux rigidus, where you can just get arthritis of this joint. Now, there are some operative procedures for that. This is what it kind of looks like on x-ray, but it depends. There's a lot of different places. You could get a hammer toe, where your toe starts to go up like this. You could get a curl toe, a mallet toe, which can also be painful. Yep, I'm orthopedics. I do mostly hip and knee replacements. When I stand, the back part of my knee pops out. It's not uncommon. You can get cysts in the back of your knee. Sometimes it's called a Baker cyst. I'll show you a Baker cyst. Especially, it sounds like you got a lot of fluid and stuff going on in your knee. So Baker cyst can be very common. So here's a Baker cyst. This is the front of your knee. This is the back. When you get inflammation or damage to the meniscus in the middle, or arthritis, then the fluid tends to go in the back, and you get this thing called a Baker cyst, and that's what you can feel. Thank you for subscribing. Very much appreciate it. If you guys have any x-rays or any images you want to drop, just drop them in the Discord channel, and I'll go ahead and answer them. Have you seen avascular necrosis? I commonly treat avascular necrosis. Avascular necrosis is bone death. It usually, thank you for the follows. It's bone death from usually a loss of blood supply. And when you lose that blood supply, then you just get destruction and collapse of the joint, and end up needing usually some type of replacement operation, meaning you could need a drilling into the bone if it hasn't collapsed. But if it's collapsed and it's very painful, then you would undergo a replacement. Should I seek treatment? It depends how much pain you're in. If you're in pain where it's affecting your quality of life, it's affecting your, if it's affecting your day-to-day activities, if you can't do what you used to, then I would definitely probably see an orthopedic specialist. You could probably see a sports specialist or a joint specialist. You're young, so it may be helpful to go to a sports specialist, and they could, or a knee specialist, and they could treat you and help get you better. Yeah, the Discord is a chat channel. So we got about 5 doctors in the Discord. And then we have, I think, almost like 80 people in the Discord channel. But people are just posting pictures. It's a medical community. Just try to focus on medical education and things like that. And, if anyone puts any x-rays up, I'll take a look at them. Thank you for the follows. Appreciate it. What are your thoughts on stem cell injections in the knee? Stem cell injections, there's not a lot of literature on them. I'm not usually recommending them. RIF distal radius, put back together, been going to therapy. Supination stuck at 49%. Very hard to hear. Very sorry to hear that. Supination is this motion, and pronation is this motion. Supination is one of the hardest ones to get back after you have a really bad fracture like that. So that's something you can definitely lose, but just keep working. You can get improvements in range of motion even up to a year. How do you go in the Discord? How do you get into the medical chat? You click on my profile, you go to my bio. In my bio, there's a link that goes to Discord. You go in the Discord, and then you can post and talk in there. So that's the medical chat. They told me my tendon is wrapped under the knee and not on top like most people. How is this corrected? I'm not exactly sure. I would have to see your MRI. People can have different patella tendons where they're short or long. They all tend to go to the same spot, but that could be a symptom for if yours is shorter or longer, or in a different spot or more out to the side. That could be a cause of tendinitis. Can you tell us your thoughts on hip dysplasia? Does surgery prevent arthritis? Well, usually for hip dysplasia, It depends how bad it is and how old you are. If you have arthritis, then we would do a replacement. If you have like a dysplastic hip and they're trying to rotate or do a PAO, that's a really big operation. If they're trying to go in there and shave down the bone, that's a less operation. But end stage hip dysplasia is usually getting a replacement. How painful is it to be a bone marrow donor? Usually you have a lot of pain over your pelvis, so the back of your pelvis, your iliac crest, where they harvest the bone marrow from. Can one do a virtual visit with you and send prior MRIs? Yep, I do virtual visits. If you click on my bio, you can schedule a telehealth visit, or you can just call the number, and I do telehealth, and then you can send all the scans over via email. What's a white blood cell scan for? So white blood cell scan is to look for activity. If there's increased activity with the white blood cell scan, they're usually using like glucose to see if it's taken up. If it's taken up, there could be a sign of infection or loosening, is most of the times while we're doing bone scans or white blood cell scans. What do you do on a knee replacement where there are no ligaments? So it depends exactly. Let me see. Let me just make sure. Okay. It depends exactly what's going on with the ligaments. If they're completely shot, we can do something called a hinge. So I'll show you guys that. Let me pull up a hinge knee replacement. So a hinge knee replacement goes... Okay, so this is a hinge knee replacement. So this is a hinge. You can see the replacement goes in the bone and it's hinged, meaning it's locked. It's completely constrained at the bottom. So that's what it looks like. Those are the hinged knee replacements. So that's what we do when there's no ligaments. And so if there's no ligaments, the hinge basically prevents it from wobbling or falling out of place. So a hinge is the go-to for completely incompetent ligaments. Now, we have really good primary implants that can kind of compensate for poor ligaments. And if they're completely gone, hinge is the goal. What causes complete loss of cartilage, bone on bone, hip all of a sudden? Could be autoimmune, could be medication or trauma induced. Could be family history, could be you're just prone to it, genetically unlucky. So there's many things that cause arthritis. How long post-septic arthritis do you recommend another clean out? If you're not infected, I usually don't recommend a clean out. If you had septic arthritis and it actually destroyed your cartilage, then you may end up needing a replacement at some point. If your meniscus was torn or something like that, you could go for a scope. Can a modern knee replacement hold up to continued strenuous activity after recovery? Yes, I have a lot of patients who are very active. I actually have a few patients who are running after their knee replacements. You can play tennis. Many people play tennis, golf, but when I do a knee replacement, I don't put any people on restrictions, meaning whatever you feel comfortable doing. So I do have patients who do run and go for some light jogging, but swimming, tennis, biking, golf, all those things are acceptable to do. What would you suggest for osteoarthritis? So anti-inflammatories, medication, physical therapy, ice, brace, injections with gel or cortisone, and then the final stage would be replacement. Do they make hip replacements with a 3D printer? So they do print, and sometimes they'll print the porous coating on them. The 3D printed implants are very finicky and very, very expensive. So what I do is I take a computer and I take a picture of your bone and I load it into a computer and I do a computer template. So I get a size for what custom fit your bone will be. And then after that, when I'm in the operating room, I recheck and I use x-ray to double check. And so the implants come in different sizes. So all of my hips are a custom fit hip replacement, but they come kind of pre-packaged and you figure out the sizes based on your templating and based intraoperatively. So I don't use computer template or computer 3D printed implants. Do you have any experience with quad tendon ruptures? Yes, I've repaired a lot of quad tendons. Osteoarthritis, chronic knee pain. I'm very sorry to hear that. Hopefully that gets better. But you can do things like injections. Arthritis takes a lot, can flare up. You can get back down to baseline. If you get back down to baseline, then it's hard to say when you'll need a replacement. But if you have bone on bone, if you have poor quality of life, that's when I'm doing replacements. All right, let's see if anyone's posted anything. Okay. Lori, oh, 2 people in the Discord. We got 2 people in the Discord. Hello, just saw the TikTok live. I recently got diagnosed with hip dysplasia. I only have x-rays at the moment, so don't know too much. I thought I'd send the x-ray. Sure. If you send those x-rays, I will pull them up and we can talk about them. No problem. Lori says, hello, 5 weeks post-op from a revision. Total knee. Said rate's 20, CRP's 33. Very sorry to hear that. I would trend it. So if it continues to trend in a poor direction, you may have an infection. So the other thing is, so 5 weeks, if they're drawing those levels, then they should draw some fluid out of your knee and check. Marcy posts an x-ray, so it's hard to say exactly what's going on. So it looks like we got an x-ray in the Discord channel. Thank you for the rose, Lisa. Very much appreciated. Thank you for all the double taps likes. It's hard to see on here, when you have heel pain back here, we don't just want a foot x-ray. So we usually get the other views. So it's hard to say what's going on exactly. It does look like you have a little bone spur off the back of your heel. So many people with heel pain can have heel pain in 2 spots. You can have it at the very back, like by your Achilles tendon. That's usually heel pain from Achilles tendonitis. If you have it more up front or on the outside aspect, that tends to be plantar fasciitis. So those are the most 2 common things we see with heel pain. But it's hard to tell from that view. That's not the kind of normal view. Lori sends, or here we go. All right, I don't want to put any of your information on here, so I don't want your name or anything. So, okay, x-ray. This is a x-ray of a revision knee replacement. So usually when I'm doing a revision knee replacement, there's a couple different things you can do. If it's a big revision, then sometimes you can just switch the plastic in the middle. But if you're doing a big revision, then you would take everything out and put something new in. Here, this is what we call a revision stem, meaning this gets good fixation all the way down. It looks like you had a previous surgery, whether this is an ACL or a high tibial osteotomy. Staples were used in the past for high tibial osteotomies. Anytime you have a previous operation like that, it makes you at higher risk for infection and complications and things like that. So if you're 5 weeks out, if your infection markers are elevated, we would stick a needle in the joint and we would draw out some fluid and then we would test it to see if it's an infection. If it's an infection, it could be 1 or 2 things. It could be an early infection, which you could just switch the plastic piece out and watch it. Or if it's a later, more serious infection, you would take everything out and you would put in a spacer, an antibiotic spacer. Get you antibiotics, try and clear the infection, and then try and get this thing healed. All right. Have severe pain in the bottom of my heel with burning up the sides. That could be a nerve, could be some plantar fasciitis. I've had 2 total knee replacement surgeries. Hopefully you're doing well. Hopefully you've healed up nicely from those. It's always good when you're more than a year out from those operations. I do everything I can to prevent infection. I give antibiotics before, during, after. And so my goal, infection's the worst thing that can happen. We try and avoid it at all costs. Meg, does a torn meniscus need surgery if I'm not healing with exercises? I would probably give it 4 months, 3 to 4 months. If it doesn't get any better with anti-inflammatories or exercises, then I would say, you could get an MRI. 1 year for an MRI, that's a long wait. Yeah, Canada. Delayed for everything. What causes bone spurs? Bone spurs is usually a sign of inflammation, meaning if you have chronic inflammation that goes on for a long period of time, you get a bone spur there. Bone spurs on your heels, very common for where the Achilles tendon goes into the heel. Thank you for the follows, all the double taps, likes, appreciate it. We hit five subscribers, so I really appreciate the subscriptions. Hip replacement 3 months ago, still constantly in pain. Going to the doc in 2 weeks. Very sorry to hear that. I would get an x-ray. You could look on your x-ray if there's any signs of loosening. let's see how far out you were. You were 3 months. Yeah, you may want to give it to 6 months, but if there's any signs of loosening, you may have to change out the implant, but usually that's rare. Where did you get your MD? I went to medical school in Louisiana. I did my residency in New York, and I was down in at University of Virginia for my fellowship training. Very far past my MD. That was a long time ago. Well, maybe not that long, like 10 years. Thank you for the follows. I appreciate it. Let's see. We got another x-ray. Twin posts. Hip pain from limping because I have plantar fasciitis. Hip pain. I don't see too much going on. So this is your x-ray. So let me actually blow this thing up. So we got another x-ray. If you have x-rays, you can post them in the Discord channel. I'll go ahead and look at them. So this is a hip. This is what we call a lateral view. You're in Lafayette? Yeah, I grew up in, I was in Shreveport for a little while, but this is a lateral view of the hip, meaning the hip is turned to the side. Gamer Zone Games. Hey, what's up? Yeah, I'll answer it in just a second after I do this x-ray. So this little bump is what we call a cam impingement. So it kind of looks like you have something called femoral acetabular impingement, meaning you have this little bump here. I would want to see the other view of your hip. So sometimes impingement in the hip can cause a labrum tear. A lot of people from Louisiana. No, unfortunately, I'm not in my 20s. I wish I was in my 20s too. Gamer says, I have right kneecap sharp pain from limping. Very, very sorry to hear that. You could get an x-ray, see how the kneecap's tracking, things like that. Rule out other issues. Okay, look, we got some more views of the pelvis in here. Let's take a look at them. Okay. Yes. You look so young. You look so young in your picture. So you have hip impingement. Let me see how I can do this. Yeah, so you have hip impingement. So I know it's not the easiest to see a screen on a screen, but let me see how I can get this where you can see it. So your space is narrowing up here, and you have this bump here. We call this a cam deformity. You have a bump here. We call that a pincer deformity. So the cam and pincer bump into each other. What they do is they create damage in this space. So the things in this space are your labrum, which is your shock absorber, and your cartilage. And you even have a little cartilage wear. You don't look that old in your picture. So it would be, it seems, the other thing is your socket's a little shallow. So you may have had developmental dysplasia when you were very young. Many people with these issues, meaning hip dysplasia, shallow socket, impingement, they end up needing hip replacements on early, very like 30, 40, 50 years old, much younger. And so if that's going on, there's a couple different things you could do. I would obviously get a... okay, so yeah, they told you have hip dysplasia, hip impingement. I agree with both of those. Yeah, it almost looks like you even have some early arthritis, which is unfortunate for your age, being 18, Kyla. So, what are treatment options? I would definitely get an MRI. The MRI will tell us a couple things. Tell us the status of your labrum, if it's repairable, or if it's fixable, or if it's able to be cleaned up. The other thing you could look at is you could look at the cartilage, see if there's any cartilage damage. What can we do for hip pain? We can do anti-inflammatories. There's things like meloxicam or Celebrex, which are better medications. Obviously, one goal is to try and avoid a hip replacement when you're 18 years old, because the hip replacements are good, but they don't last forever. So one of the important questions to answer when you have hip dysplasia is, how is your quality of life? Meaning, do your hips hurt you every day? Do they wake you up from a sleep? Are you able to walk? What's your activity level? Are you able to do the things you want to do? And so, let's say you couldn't do any of that, meaning it's even painful to go for a walk or go upstairs or things like that. Then you would say, okay, this is really bad. Hip replacement's the final solution. But if you got a hip replacement at 18 years old, you would probably need a revision surgery at some point, probably in your 40s, 50s maybe. They're very good. The longest lasting hip replacement was an older generation model, which I think was like 70 years. PAO is too big of a, if it was me personally, there's people out there who would try and do a PAO on you. you look like you have a little bit of arthritis. And so if you have arthritis, then PAO usually isn't a good operation. So I would probably avoid a PAO, but an MRI would give you a lot of information. So hopefully that's helpful, Kyla. And sorry you're dealing with this. I have a small labral tear, hip dysplasia, partial split in the minimus. Not uncommon when you have hip dysplasia, tear in the labrum. You can also get damage to the muscles. OrthoLife says, Doctor, can you guide me on how to do a fellowship abroad? Unfortunately, it's very hard to do fellowships abroad. There are some programs, I guess, across the country, but I don't particularly know of any of them. So it's difficult. They're so competitive even between local people who aren't abroad that it becomes hard. Thank you everyone for joining the Discord. So for those of you who don't know, we're getting x-rays posted in the Discord. If you want me to look at your x-rays or your images, you can join. Click the little plus and I'll just take a look at them. But starting up this medical Discord, it's looking pretty good. I think we're up to about 80 people. We got 5 docs in there. Some of the docs on here. Trauma ICU doc is in there. See the Med Life is in there. Dr. Sood is in there. Chet Donnelly, Dr. Evans. So we got a couple people from a couple docs from TikTok in there, and just trying to create like a nice medical educational community. Hey, good evening from Texas. Welcome to the live stream. Thank you for joining. If you have questions, either YouTube or TikTok, I'm answering on both. Hip replaced 5 years ago. Pelvis was fractured during the surgery. Pain near groin. Options. That's a tough one. Hopefully the pelvis is healed. If the pelvis is healed up all the way, then there isn't much to do. If the cup is going in or the fracture is getting worse, then there would be issues, and you would just follow x-rays to see that. Thank you for the gifts. Thank you for the subscriptions. Very much appreciate the support for the channel. 59-year-old waiting for left hip replacement. Any advice? I had an MRI and I'll get a gel shot, or I'll get a shot on the 30th. I was going to say, so we're only really doing cortisone in the hip. We're not really doing gel in the hip. Shot can give you a little bit of time. It doesn't work as well in the hip as it does in the knee, unfortunately. I have really good guides on my website for different exercises you can do, a hip conditioning program, how to prepare for hip replacement. I usually give my patients meloxicam and Celebrex, which is an anti-inflammatory that usually helps pretty well for joint arthritis. Do I do bunion surgeries? No, my partner does bunion surgeries. I do mostly hip and knee replacement. Have you ever removed a coccyx bone, old gymnast injury that won't quit? Very sorry to hear that. A lot of the times we're not removing coccyx bones. Unfortunately, it really just depends. If you had a non-union that was persistent for maybe 1 or 2 years, it could be taken out. I should probably ask Chet. Chet's my Discord spine surgeon. So if you drop it in the Discord channel, Chet would probably answer it. So what's the maximum BMI to do a replacement surgery? I usually recommend a BMI under 40. Now, it's not my hard cutoff. I have replaced joints with a BMI over 40, but it's kind of the safest. From upstate New York, welcome to the live stream. Are gel injections seen on a Maverick MRI? If you did a gel injection and got an MRI right after, you could see the fluid. It probably sits around for a little while. Need a right hip. Let's see. Need a right hip because bone on bone. Is anterior better? I do anterior hip replacements. What do you recommend for a 75-year-old with a meniscal tear, pain 6 out of 10? I would try an injection. Usually if it's just a meniscal tear, you could go in there with a camera, but if you have arthritis, then, it's not good to scope knees with arthritis, but, if you had no other options, you could do that. And then if you had underlying arthritis with your meniscal tear, you could do a replacement. Thank you for the roses. Appreciate it. Hershey Mike is the top #1 viewer for the day. Thank you. Thank you for the support. My knees make so much noise. They feel weak, but they don't hurt. Just scared to tear something. I'm worried I'm going to get hurt too. I don't, I would say switch your activities to lower impact. Things like biking, swimming, elliptical. Thank you for the follows. Osteoarthritis, thin cartilage, constant pain in the knee, 51 years old. Very sorry to hear that. Hopefully that gets better and improves. Let's see. Looks like we got like 8 new people in the Discord channel. So Awesome. You guys are great. Let's see. Let's see what other questions we got. I have a lot of snap and popping. It depends if it's on your hip or your knee. There's external hip snapping syndrome. There's an internal hip snapping syndrome. Do you make your patients wait to be a certain age for joint replacement? I'm 43 and have had to. No, I don't make my patients wait. As long as you have arthritis and you have poor quality of life, then I would do a hip replacement operation. AVN, 3 joints collapse. How common? Very common. Are you on steroids? Are you on long-term steroids? Are you on any anti-rheumatologic medications? Are you on any autoimmune diseases? Those can all cause AVN. What's your opinion on hip resurfacing? My opinion is don't get a hip resurfacing. It was an older procedure that was done. It's a metal on metal hip. Some people have good results, but their metal ions go up, and then you may likely need a revision. So I would avoid hip resurfacing. Was told osteonecrosis. Do you see it? I don't see an X-ray, so I can't see if there's osteonecrosis. The thing is, so early osteonecrosis you can't really see on an X-ray, so let me see. And then the other thing is, whenever we're reading X-rays, we're usually looking at like very nice computers to see them better. So it looks like there's a little sclerosis. I can't really tell looking at the image on this. But you may have a little bit of medial femoral condyle osteonecrosis. What's your opinion on resurfacing the driveway? Depends what material you're using. I got something in my throat. All right. What's your opinion on, or how common is septic arthritis in kids? Can it be reoccurring? My daughter has at 2 years of age. Oh, looks like we got another subscriber. I guess it's Dry95. Thank you for subscribing. So, pediatric infections in the bone. There can be different autoimmune diseases that cause that, meaning they're very specialized diseases. So I would check for those. So make sure you probably see a pediatric doc. They'll probably work your child up to make sure there's no diseases that immunocompromise them. There's a lot of different diseases in kids that can cause that. There's, things as simple as like cystic fibrosis or some genetic disorders that can cause that as well. Giant 95, please don't choke. Yeah, I know. I don't know what it is. Too much talking. I got something in my throat. Thank you for the subscription. I appreciate all the support for the channel. My goal is just to help educate, even with a scratchy throat and all. What do you think about bone builders? Like, there's different medications. Sometimes we have like bisphosphonates and parathyroid hormone. Thank you for the follows, double taps, likes, appreciate it. There's a bunch of different things we can use to build backbone, especially if it's weak. If you have an X-ray, you can drop it in the Discord. We got plenty of people dropping their X-rays in the Discord channel. I'll take a look at it and let you know what I think. But yes, MO. You may have some medial condyle sclerosis, which could be an indication of osteonecrosis. If you're on YouTube too, I'll answer your questions there. I am reading the chat on YouTube as well. Appreciate all the support. Should I have my bone spurs removed? Bone spurs are not so much a sign of or what's causing the pain. Bone spurs is more a sign that something is inflamed. When something's inflamed, the way your body heals it is it wants to make it stiff. The way it does that is it creates a bunch of bone around the area. We call those bone spurs. We can see them on an X-ray, so it's a sign of damage, inflammation. My son has a growth on his shin. He says it's on the bone. That could be an osteochondroma. Osteochondroma is a very common bone growth. You could get an X-ray to see it. If it starts to hurt the muscles or hurt the nerves, someone would probably take it off. I got stabbed with a fishing knife a few weeks ago. Femur, chance of infections. Say the chance of infection is probably pretty high. Obviously, it depends on how deep the knife went, how long it was, how dirty it was. But anytime you get a penetrating trauma with something dirty, especially a fish thing, meaning it's had water on it, fish have a lot of bacteria. I would definitely, if it was a big knife, look at it. It depends if it's turning red, if it's leaking, pus, if it's oozing, definitely get antibiotics. But if it's a big cut too, you may need stitches. So it just depends on how big, how deep it went in. Fractured my fifth metatarsal 1 week ago. How fast does it heal? Bones usually take about 8 to 10 weeks to heal, unfortunately. Depends where you fractured it. A lot of the times we can let you get back to kind of full activity a little quicker if you're younger. I have osteoporosis at 44. Hip knee pain is terrible. Very sorry to hear that. Sometimes when you have osteoporosis, your bones get weak and they collapse over time. Bone spur destroyed my shoulder tendon. Now I have a Popeye arm. Hard surgery. Yeah, they can do a biceps tenodesis to try and get it back. If you have rotator cuff issues, they can try and repair the rotator cuff at the same time. What are your thoughts on stem cell versus hip replacement? There's great literature on hip replacement. It is a very predictable procedure. Stem cells, it doesn't regenerate the cartilage, unfortunately. We don't. They're just not doing what we want them to do, so there's not good data on it. Oh, okay. So we got another X-ray in the chat. This X-ray is a percutaneous non-union. So my question to you would be, what kind of doctor did you go to? Did you go to a podiatrist or did you go to an orthopedic foot and ankle specialist? That would be one of my first questions. I don't know very many orthopedic foot and ankle specialists who are, trying to do something perc without any fixation. Maybe they took the fixation out to try and get it to heal. We're usually using a plate and screws. This hasn't healed, obviously, so you probably need you would give it 6 to 9 months, see if it heals at all. You could get a CT scan of it to look at it. You can make sure it's not infected. If there's not pus coming out, then you would need a revision procedure, which would probably involve bone grafting, a plate and screws to try and get it to heal. Unfortunately, anytime you cut a bone, realign it, that is a risk that it doesn't heal, but I'm very, very sorry to hear that you're going through that. How do you set up an appointment, a telemedicine appointment? So if you go to my link in my bio or MatthewHarbMD.com, you can just click online appointments. I do telehealth visits. I see a lot of people from all over the country. Oh, the non-union was caused by an infection. Yeah, so that's a little bit different. So it sounds like they took the hardware out to try and clean it out. Probably give it a little time. If it doesn't heal or it's still mobile, but I would probably give it like 6 to 9 months to heal without putting any metal in there. It looks like it's in an okay position, meaning the bone looks like it hasn't shifted at all. The question is, should you get an MRI? A follow-up MRI may be helpful to look. So I would probably get an MRI to look and see if there's any further infection. If the infection's clear, you could also get infectious lab markers, meaning ESR, CRP. Those are infection markers. And then you'll probably ultimately need a revision, which is like bone grafting, plating with another plate to try and get it to heal. I'm in residency now, intern year. What do you think about the next 20 years in total joints? I think the next 20 years in total joints are going to be absolutely amazing. We are already doing more and more outpatient joint replacement. I do about 60 to 70% of my joint replacements outpatient. Why do most surgeons do general anesthesia instead of spinal? I do all my joint replacements under spinal anesthesia. Should I see a rheumatologist for osteoarthritis? I would probably see an orthopedic specialist, depending on what joint is bothering you. Now, if it's overall, meaning you have osteoarthritis in your whole body and you think it's because of an autoimmune disease, that you would see a rheumatologist. Right knee clicks when I wake up and walk, goes away after 5 minutes. Many people have that. You can have thickenings around your knee. We call those plicas, or hypertrophy of the capsule, meaning the capsule gets very thick. If the capsule gets very thick, you can have these clicking sensations. Thank you for the follows. Appreciate it. Not uncommon. My knees click as well, as long as it's not associated with a lot of pain. Yeah, very, very sorry to hear that you're going through that. But bone grafting is the only way we get non-unions to heal most of the time. Or you could do a shortening osteotomy, meaning you could just cut away the dead bone and then try and get it to heal. But I appreciate all the support. So the Discord's running strong. We're going to get some more doctors in the Discord channel. Just make it a nice educational medical community. We'll probably, I don't know, maybe like set up some sessions where they join in on some live streams too. I'm having a right hip replacement in January. I need to lose weight. Ideal BMI is less than 40. Did you do your case collections? Yes. So I'm a board certified orthopedic surgeon. Advice for dish pain, you could see a back specialist, an orthopedic spine, rheumatologist, ortho. Usually we treat dish conservatively until we can't anymore. I had an osteotomy 20 years ago due to a total knee. Oh, would definitely not make it to 50. Oh, due for a total knee. Yeah, I mean, many times we're not doing osteotomies as much anymore because it's very easy to correct the joint with either a partial knee replacement or total knee replacement. So I would say osteotomies are kind of fading out a little bit. Is it easy to retreat an ankle with a hard step down? I don't really understand that question. To break an ankle with a hard step down, usually not. Oscar says something in Spanish. Sorry, Oscar. I don't know. I don't think YouTube chat translates the question. So if you could put it in English, I can answer it. Mid-labrum tear per MRI, what to do? A lot of times labrum will heal on its own with conservative treatment. But I appreciate all the support. Thank you for the subscribes. It looks like we got 3 new subscribers today. If you're a subscriber on here and you want to be, I'll give you a little subscriber badge in the Discord. You could just shoot me a message. But I really appreciate all the support. I'm going to try and do more of these live streams. But you guys have been great so far. And I hope everyone has a good night and a good